What's your first thoughts when you hear the words holistic medicine? Is it drinking a green shake of some sort with a bunch of grass in it, or maybe meditation, whole foods, it's too expensive to eat healthy, those kind of things? All the above. And but what if your thought actually was a combination of a spiritual side, your medical side, mental, physical health, all that combined? Well, that's actually what our panel's gonna talk to us about today. But before we get started with them, I'm gonna let Brooke come back up and give us some more information.
I think you're spot on when you talk about not only is it what we put in our bodies, but our mind especially, so our mind, body, and soul, and looking at the holistic approach, and resilience, right? So among our active duty families who have decided to stay in the military service longer than they had originally planned, nearly half of them reported because it was of healthcare benefits. And so we were talking about this at lunch today, that our healthcare system for our military families can really be an asset, but there are some tweaks that need to be made, because 10% of active duty family respondents said that their inability to access healthcare was a primary reason for them choosing to leave the service. And 1 in 4 active duty families report that they currently receive mental health care, so we're incredibly proud of them getting the support that they need. But another 22% report that they would like to receive care but can't get it. I talked about a little bit about the ghost networks earlier this morning. But another thing too is that I was a clinical therapist for many years. I have my MSW. Therapy was not for me. It is not for everyone, but it is for some who are really fabulous. And a lot of my good friends are therapists, and they want to work with our military and veteran families, but there's a couple reasons why they can't. So TRICARE has to select you, and sometimes there's too many providers in that area, and so they won't let more providers in. But when those families go to those providers, they say they're full. Another one is that TRICARE is the lowest reimbursement rate compared to a lot of other insurances. So when you have private practices, you're gonna want to get the reimbursement rates that are a little bit larger so you can pay your bills, right? And lastly, it has taken some of my therapist friends to get paid over a year to get reimbursed. And so when you're a small-time business owner, those things really deter you from taking on military and veteran families. Another thing, as I previously mentioned, one quarter of our active duty family or our active duty service members report that their command had experienced a suicide in the past 12 months. And we need to take that seriously. So one of our policies our policy priorities is funding community suicide prevention efforts for service members and their families. We are a recipient of the Staff Sergeant Fox Grant, which is a veteran community suicide prevention program. And we believe that this program could be extremely effective with our military families and not just veterans. And then the last policy that we are working on is maintaining and expanding Defense Health Agency funding to promote health and well-being and readiness of military families through outdoor activities on public lands. Our research has shown that when families participate in outdoor activities, not only is it great for their physical health, but it's fantastic for their mental health and well-being. And it's a great way to spend some quality time with your family. So, thank you.
Thanks, Brooke. Appreciate that. I'm not gonna even pretend to be Meredith, the first moderator. So I'm not gonna throw out a bunch of statistics and that type of stuff, because that's, yes, I am the spouse of Major General Reverend Lowe, but I'm also me. I'm an advisor for Community Club, and I'm also a volunteer personnel officer for a nonprofit, and a few other things. And so many spouses, we wear different hats. And so after 33 years of military life, the health factors fall in, and you have kids involved, and that starts to find the right dentist, the right orthodontist, all that good stuff every time you move. And I know in Albany, we struggle trying to find the dentist that's not an hour and a half away. So those all fall into, worrying about when you PCS. Some people just worry about, where am I gonna get my hair cut? But it's, like Meredith said, we've got employment, housing, all that good stuff. We also have health to worry about. Where are we gonna find those providers? And our panelists are gonna talk about how all the parts of holistic medicine intertwine together. If you can share that from your perspectives, and then maybe if you've got any new initiatives or anything coming out, if you can share those with the audience, that'd be great. And I'm gonna let you guys introduce yourselves.
All right. Hey, good afternoon. My name is Mary Izagiri. I am the 46th Surgeon General of the United States Army and the commander of U.S. Army Medical Command. But today I'm here as a family doctor. I have been in the Army. I'm one of those people who stayed longer than I planned. I came into the Army because I had an acceptance to med school in one hand and absolutely nothing else. I'm not sure how I actually got down to med school, but when they told me how much it was going to cost to take out a big loan, the Army looked really good. So I didn't come from a military family to start, but I would echo Major General White's quote, "I am a soldier and I love soldiers." And that makes it really easy for me to be the family doctor to soldiers, because I can't think of a more deserving population than our soldiers and our families and our sister service members and families. I'm also the wife of a veteran. So my husband is served 22 years as an infantry officer and an intel officer. And so what that means is that every morning before I have my first cup of coffee, he's already scanned all of the news. And he's telling me about access to care challenges in the military and saying, look, you're the Surgeon General, you better do something about that. So I'm happy to talk about that as well. I'm also a mother of soldiers. So I have 5 children. Our oldest is 27, our youngest is 8, so he has not yet made a decision on which service he's going to join. It's a SMA, I'll bring him over and you can work with him. But my son is a cyber analyst over at Fort Gordon, and my daughter is a cadet at Baylor. And so care of Army families runs incredibly deep for me. I do believe that as a doctor, a big part of my job, and you heard it on the first panel, is that educate. Doctor doesn't mean anything to do with medicine. Doctor from the Latin means to teach. And so I believe one of the greatest things we can do as a military community is come together and assist our service members and our families and teach about how they can support one another, and then provide that access to care at the right level. And that's where, to me, holistic health comes in, is where are those areas where we can self-rescue, if you will? Where are those areas that it's a community rescue? And I think there's so much strength in that. And nobody could do that better than the military if we put our minds to it. And then there's times where we do need additional resources, and how do we make those readily available in a current way so that our soldiers and our family members can access that across the board. So again, 30 years doing this, and right now what's different in now than the first years I started is that we partner with the Defense Health Agency in order to run some of the programs. And so any of the TRICARE questions, I am happy to take back for you or share what I know about it. That does fall under our partners with the Defense Health Agency. And so we look forward to any conversations there. But some of the things that we're doing in an innovative way, as far as, I'm a big fan of prevention as well. I'm a doctor of osteopathic medicine. So holistic, kind of from my first training, is how do we bring health and wellness into our formations, and health and holistic fitness, H2F is one way we do that. And as we look at the need is great, how do we bring other folks in? So we are developing ways that our medics from the very start are part of that proactive program where they are supporting the health and holistic fitness of our soldiers, so that we can be as resilient as we need to be in order to defend our nation. So excited to be here and to, with my fellow panel members, talk about how we can most effectively support our families.
Cool. Well, good afternoon, everybody. Hope you all having a great day. I am Chaplain Bill Green. I am the 26th Chief of Chaplains for the United States Army. My journey probably started off a little bit different than probably some chaplains, I would say, maybe even most. So I started off as an enlisted soldier. I was a 13 Bravo for a little while, and then I was a 31 Echo, which is a field radio repairman. And while I was in the Army, I got a call in the ministry. I got a call. And from that point on, I decided I wanted to pursue that call. And what that meant was, hey, I had to finish up my degree and then also go to seminary. And so that's what I did, and I've been doing this now for a little over 30 years as well. My passion is really taking care of people. I feel like that's what I've been called to do in various ways. I think everybody matters. Absolutely everybody matters. And because of that, I'll pretty much go through any length to walk along with someone. And that may mean many different things in terms of just saying walk along with them through life's successes and also some of their challenges when they experience what some call the tragic sense of life. You know, the ebbs and flows, the things that go well and the things that don't go so well. I'm passionate about religious support and spiritual support, and I'm a big proponent of the First Amendment, right? Of course, the freedom of religion. My job is to help protect that, to help my leaders also protect that as well. And so one of the things that we are currently doing, we rolled out just a couple weeks ago, the Spiritual Fitness Guide. We believe that foundational to all of the other domains is spirituality. And notice I'm using that term on purpose, spirituality. A person may choose different ways to express that spirituality, but it can include religion, it can include values, a number of different belief systems, things that they inherited, or at least beliefs and processes that they inherited from their family members and loved ones. All those things are important because in the end, we believe that that's what's going to help us win our next war. And not just us, it's also going to help our family members as well. And so we spend a lot of time just really supporting folks in that particular realm to ensure that they feel supported, even if they have no belief at all. We want to be there to absolutely, as a chaplain, to support them. Family to me is extremely important, and I know it is to everybody, but I say that because really the way a soldier is going to get through any type of deployment or any type of, really through life, is to be surrounded by a really strong family network. And in the United States Army, that's one of the things that we do our best to support, and I know my fellow chiefs of chaplains from the other services, they feel the same way. It's about us connecting with the family and then doing the things that we need to do to ensure that that they are growing, that they are thriving, and that they are healthy. And that means a lot of different things that other, at different times. But it's extremely important because in the end, as I said before, we want to win. If we have to go to war, we want to fight and win our nation's wars. And we believe that it is through that particular spiritual domain that we're going to do that. A long time ago, a former chief of staff of the Army and statesman said the soldier's heart, soldier's soul, soldier's spirit is everything. And that without it being nurtured and cared for, that the soldier would fail him or herself. And so we see it from that perspective, that it's extremely important to ensure that folks are getting the things that they need in order to be the best that they can be, and then also to give them the space to do that as well. I'm the dad of a daughter who's married to a soldier at Fort Stewart, Georgia. Oftentimes when I go to Fort Stewart, I kind of sneak on the base and just be a granddad, right, and a dad. And that's probably one of the things that gives me a lot of joy. We have 3 kids, my wife and I, Robin. We've been married for quite a while, right? We just celebrated our 41st anniversary. And so we've been on this journey, right? And so a lot of this spirituality and religious support stuff I have to apply to my own self. Why? Because, in relationships, there are ups and downs in relationships, and we don't take that for granted, and we don't pretend that, hey, it's, just nice and smooth and all those things. But we live life, and we thrive in the midst of living life and doing that in a way in the context of our religion and the support that we get from that. So it's a pleasure to be here, and I'm looking forward to the questions and also thankful to sit on this panel with the rest of the panelists as well. Thank you.
Well, sir, we're very happy you answered that call when you had that call. Right, absolutely. So I am Jen Crockett. I am a psychologist. Hear me all right? I'm making eye contact with you. Thank you. Thanks for that head nod. I'm Jen Crockett. I'm a psychologist. I am originally from Atlanta. I currently live in Auburn, Alabama, and our Auburn Tigers play those Baylor Bears on Friday, just putting that out there. I am the spouse of a retired service member. He was Army, he was infantry, he was here several times, so I feel very at home here. My family also, my dad grew up in Columbus, so it's really great to be here. And before I leave, I'm gonna go find, there's a paver that my husband has out there somewhere, so I'm gonna go find that. So it is really just an honor to be here. I work at Kennedy Krieger Institute. Any hands, anyone who's heard of Kennedy Krieger? All right, thanks, Rebecca. Good. So great, I have some great information hopefully that I can share with you. Kennedy Krieger is a children's specialty hospital in Baltimore, Maryland. But I fortunately am able to work remotely 100% from Alabama, which is where my family needed for me to be at this point. But we see children, the hospital as a whole. We have, obviously we're in Baltimore, but we have regional, national, and international reach. And so I'll talk about some of those programs today. I was honored to be able to start our behavioral health program for military families in 2010. So through that program, I'm a child psychologist. We focus on the military child. Our goal is to take care of that, of the behavioral health needs of that child so that the service member is able to focus on their mission. So that's what we commit to doing, and that's what we continue to work on and continue to try to improve, and we'll keep trying to get it right. We've been delivering telehealth services to military families since 2015. We actually started with a pilot through DHA back in 2015 to deliver telehealth in the homes of military families. At that time, no one else was doing that. Telehealth was facility to facility. So rural America had to go to a local facility and connect with the specialist in the city and and DHA said, we don't really think that's the way it should be. So obviously that pilot went well. The TRICARE policy changed in 2017 to be able to deliver telehealth in the homes of military families. So TRICARE was really ahead of the game when the pandemic hit and everything switched over to virtual care for a bit. So we're certainly honored to grow that program over the last 10 years. And then we've also had the opportunity to be a part of the DoD Child Collaboration Study. So this started in 2021, and we were initial partners with the Center for Deployment Psychology and through the Uniformed Services University. So hopefully CDP, or Center for Deployment Psychology, is familiar to some of you out there. The project existed at USU, and Kennedy Krieger was the first partner. We've enjoyed congressional funding from 21 to 24, and we were actually able to grow this project. The focus again is on the military child and that child's family. We now have Georgetown and MedStar that's part of the program. We have University of Minnesota focused heavily on our National Guard and Reserves. And we also have Uniformed Services University, Department of Pediatrics, and Department of Family Medicine. So they're all part of the collaboration. We also have dozens of other military agencies, MSOs and VSOs who are part of this larger collaboration, and hopefully I'll just get to tell you a little bit about some of the initiatives that larger project has had to date. So like I said, it's been around since 21. We've provided thousands of military families with telehealth in the privacy of their homes. We've trained hundreds of service providers, whether they be family medicine, pediatrics, within CDCs, within the school system, SLOs, early interventions, etc. We provide through a project called Project Echo. We offer teleeducation and teleconsultation across the country, and actually to some OCONUS locations as well. That's something that all of the partners are participating in, not just Kennedy Krieger. And then we're also developing some digital tools, because we know that parents will have access to asynchronously, just meaning whenever it is that they need it. Because not all challenges need a psychologist. Not all challenges need a social worker. There are things that are, we can push out information that families can get the help and the support they need at their time, at their pace. So a lot of really great things that have been developed, and we look forward to hopefully continuing that project with 26 support. So thank you.
Good afternoon, everyone. My name is Mark Munger, and I was privileged to serve in the Marine Corps for 25 years and had the opportunity to assist Marines for another 10. But now I will get to work for the Space Force, which is very exciting. What we do within the United States Space Force is we are looking at holistic health through assisting all of our Guardians with the availability of what we call Guardian Resilience Teams. And these Guardian Resilience Teams have holistic health integrators. They're located on our major installations, and we have one team. We have one remote team, which is the one that I lead. But we have physical therapists. We have access to licensed mental health providers. We have coaches. So it's kind of similar to what H2F is doing, but it's a little different. One of the things, we are a very young force. And about 3 years ago, well, maybe 2 years ago, we started up a very novel concept that looked at continuous fitness. So continuous fitness, while I can't share any statistics yet because they haven't been shared, it's a very exciting concept that gets away a little bit from episodic testing. So what we have found is very exciting, that by physical training more with your personal fitness actually can decrease your injuries if we're not thinking about ramping up every time we test. So I think that the statistics will prove that down the road, but that's what the Space Force is doing, and we are making sure that all of our Guardians are provided with resources to help make them the most mission effective that we can. How does that help the family? I believe that helps the family because the more mission ready that we can make our Guardians, the more healthy that we can make them comfortable with their spiritual element, and the more they're able to utilize stress mitigating techniques, the better their mental wellness will be, which is going to make them more available for their families when they get home. So I'd like to talk more about that later. From a personal standpoint, I have a few Marine brats myself. I am not Army affiliated, but like I said, Marine Corps, we have Space Force now. I have a daughter who's married to a Navy ensign. And I have a son who is interested in becoming an Air Force officer. So, haven't got the Army yet, maybe that'll be a grandchild, but we're getting there. So, very excited to be here. Representative Bishop, thank you very much for the opportunity, and I'm excited to be here with the panel.